Watch me getting my spider veins done by one of the top vein doctors in the country, who's opening right here in Boca Raton. Interventional radiologist Dr. Christopher Pittman of Vein911. Most vein treatments are covered by insurance, and consults with Dr. Pittman are free. He does leg veins, hand veins, and veins anywhere on the body. Hi everybody, welcome to the Becky and Boca Show. I am going to get some spider veins taken care of. I came up here to Tampa to see Dr. Pittman because he is the vein specialist that did my hands and did my legs completely several years ago. But the good news is soon he's going to be in Boca Raton and you people won't have to make the drive up here.
We can't wait to get there and be close to Becky and Boca and the show and all the people down there. We're going to be down there in mid-July. We have been invited into Dr. Art Handel's very nice office.
He's one of my favorite cosmetic doctors. He's amazing.
My joke is it looks like Versace's second home.
Freestanding facility.
Yeah, so we're going to schlep around in that place and do vein care. Medical cosmetic head to toe. Award-winning and world-renowned.
So you're going to do hand veins there, and you're going to do leg veins and everything.
We're going to do everything, yeah.
All right, well this is very exciting. And for those of you that aren't familiar with exactly where Dr. Handel's office is, it's on Federal Highway, just north of Yamato Road on the west side. So it's a great location.
Yeah, and we're really looking forward to it.
Okay, so we're going to do some spider veins on me.
Sure.
Okay, so Dr. Pittman is going to take care of some spider veins here.
You just got a few little spider veins that have crept up since we last saw you.
Yes, I know. And you remember what my veins were like
yes.
before. And I think I could probably find a picture to put in here. I had really bad, are they called varicose veins?
You had legit varicose veins. And yeah, you look like $1 million, but it's when we got all done. But it's been a little while. Spider veins are like hair color highlights, Botox fillers, just not as often. You know, you're going to need a little maintenance every now and then. So these are going to disappear before our eyes. We call them preview of coming attractions. We're killing them. They die on contact, and then the body has to absorb them. Something a lot of people don't know about veins is the biggest ones are green. So you can tell the size of a vein by their color. So if they're big, they're green. The smallest ones, the tiniest ones are bright red. In fact, we call them tiny reds. And the color, the blue and the blue purple are in between. I can tell that, you know, you're overdue, Becky, for treatment.
I have not been
these are blue purple.
Yeah, I know.
Okay.
I have not
they
been
should
in a
have
long
never
time.
gotten past the little tiny red phase.
Well, now that you're in Boca, that won't happen again.
This needle, by comparison, anyone who's had cosmetic sclerotherapy probably has never been treated with a needle this small. This is a 32 gauge needle. Most doctors have never seen a 32 gauge needle.
I don't even feel it.
Yeah, so it's the same needle we use to do hand veins.
Okay.
And so it doesn't hurt.
Now you're using
when
foam.
You do it. Yes.
And is that unusual? Do most doctors use foam?
Most doctors do not use foam, but we can do more veins, less needle sticks, more effectively with foam. But our proprietary way that we do foam, we have recently trademarked and registered as Vein911.
Okay.
And you know, like Sonabella. Cool sculpting and all of that.
So Vein911 is your method for
our
foam?
proprietary method of foam. Don't want anybody to be alarmed. Foam is not foam insulation. It is like cappuccino cream or shaving cream. It goes in, damages the lining of the vein on contact, and it's absorbed by your blood in about 8 seconds.
So I've spoken with a lot of women that were not happy with their vein care, or it didn't last.
At least 1 out of 3 of our new patients have already been treated somewhere else. That's not uncommon at all. Or the last vein place you're going to need to go to. You can do all sorts of amazing things cosmetically and medically with foam, and we're certainly experts at it. I run a worldwide blog of 1,200 doctors, almost 1,200 doctors, called Foam Sclerotherapy Experts. And so we didn't probably know too much about foam, but unfortunately, like I said, it is not done enough in this country. In France, for instance, where phlebology or venous medicine is pretty well developed, you're going to see a lot of foam done there.
Oh, really?
A lot of foam. Yes,
Okay.
yes, absolutely. If your spider vein treatment person does not use glasses like this, they're never going to get the results we're going to get. It's just
You
not
can
gonna
see
happen.
the vein
Under
the skin with
I
that,
don't
right?
care how good or bad your eyes are. This device is more than just magnification and intense light. The patented aspect of this device is polarization. Every spider vein just shines up. It actually sees about 0.1 millimeters below the skin.
Wow.
And you just can't do the kind of job we can do if you don't use these.
So what about these women that say their vein care stops working?
So what happens is they look great for decades, 30s, 40s, and they go get spider vein treatment, and it works. It's like, it works great. And then 5 years later they get it and it works, and then maybe 10 years, and all of a sudden it's not working. Everything sags as we age, and so do our veins. There's a lot of average stuff out there. You have to be able to do medical and cosmetic really to get people where they need to be, especially if they're middle-aged and older.
Yeah.
Here, I'm gonna flatten you out here. Only Becky and Boca could make getting on her stomach look good, so we're gonna watch her do that. Like these green ones right in here. So, why don't we get a few of those? So these red ones are turning pink, and that's how we know that we've gotten adequate medicine in them. These are going to die on contact, and you're not going to look perfect immediately, okay? Because we're not removing these, right? We're just damaging them.
Right, so they're still in there.
Yeah, and so we're killing them. They die on contact, and then the body has to absorb them. But you're welcome to turn over and make yourself comfortable again. Here. Okay. So yeah, Drash will get you tidied up here so it won't look like a butcher session.
Okay.
But it already looks better, doesn't it?
Yeah, it does.
Which is going to look like you picnicked in an ant pile for a couple of weeks. The veins are already better. She just has to, she'll resolve all of this. But she doesn't have that, that roadmap.
Okay, I am with one of Dr. Pittman's happy hand vein patients. Yes. And your name is?
It's Lorena. As we mature, I think that's one thing that matures as well as your hands.
Yes.
So I looked at a few options, the fillers, and I saw your video. And working in the radiology field myself, I was familiar with Dr. Pittman and how great his work is. I trusted him to do my hands, very pleased with it, and it's a lifetime thing. It's
once the veins are gone,
they're gone.
Wow. Wow. Schoolgirl hands, that's what he always says.
But I am very thankful that I came across your video, because that was the only thing that really alerted me to the fact that
That's amazing.
That was available.
Something else you could do.
That it was an option.
All right, well, thank you for talking to me. I'm glad you're happy.
I'm glad I did it.
Okay, thank you. Okay, everybody, thanks for joining me on this episode of the Becky and Boca Show, as I brought you to Vein911, soon to be in Boca Raton.
Excited. We're excited to be there.
It's going to be great. You won't have to drive all the way to Tampa to get what I just had done.
Her legs already look better.
They do.
Yeah, so the ant bites will go away in a week or two.
Okay, well, thank you very much, and welcome to Boca Raton. We need you down there.
Thanks. Look forward to doing some stuff down there with you.
Okay.
All right.
All right. Bye-bye.
Thank you.